Let's start right here. With summer coming to an end, we're talking to experts about what this fall could bring in terms of COVID-19 cases. Health officials closely tracking cases after many predicted a surge in the cooler months.
And ABC Action News reporter Larissa Scott is taking a closer look at what the most recent projections show and how they could impact your family.
A surge in COVID-19 cases this fall and winter depends on multiple factors.
The big question is, of course, does another variant pop up out of somewhere?
That's the question that has made it difficult for scientists to predict what will happen in the coming months.
Where a lot of our variants have popped up on are places where we haven't done a lot to vaccinate individuals, and that are, places that are kind of neglected. And so I don't think that situation has changed much in the last 2 years. And I would expect another variant to, of course, pop up.
What then becomes the next question is, what does that variant look like, and does it evade our existing immunity?
Most of the people got sick within the last year from COVID, whether it was Omicron or one of the Omicron spin-offs.
The second factor that will impact the possibility for a surge is how effective the new COVID-19 booster shots are and if people will actually get them.
So then that's the other side of the story, is really behavioral. And so the virus doesn't exist in the background, in a vacuum rather. It exists with a host, and the host is us. So what we do affects what the virus does. So the question becomes, how many people continue to stay up to date with their vaccine?
Federal data show about 48% of people got their first booster dose, and only 34% of people who are eligible for a second booster got their second dose.
The number of people that are updated is not very high, especially among some of the younger groups.
Health officials are hoping the numbers will be higher for the updated COVID shots. The FDA and CDC gave the new Moderna and Pfizer boosters a thumbs up last week. The shots provide protection against the original COVID Wuhan strain and the most dominant mutations in the United States right now, Omicron's BA4 and BA5 subvariants. The most recent data from the CDC shows that last week, Omicron's BA5 subvariant made up nearly 90% of new COVID-19 infections. Since the onset of the pandemic, researchers have seen significant surges in fall and winter months. Some health officials believe that will be the case again this year. Others think a surge is still likely, but it won't be as severe as others in the past.
It's hard to predict, but those are things to watch. Watch what the virus does. Watch what the population does.
Reporting in Tampa, Larissa Scott, ABC Action News.